Welcome to The Explainer. I'm so incredibly glad you're here with us today. Look, we're tackling a topic that touches the lives of millions worldwide, and let's be honest, it's one that often feels totally overwhelming, the breast cancer treatment journey. Whether you're watching because you've just received a diagnosis, maybe you're supporting a loved one, or honestly, you're just a curious learner who wants to understand where modern medicine is at right now, this Explainer is built to give you clarity, hope, and a real game plan. Okay, let's dive right in. We're going to strip away all that confusing medical jargon and build a clear, step-by-step understanding of exactly how breast cancer is treated today, straight from the latest clinical experts. If you or someone you love has just been diagnosed, I want to acknowledge something right off the bat, that immediate, suffocating feeling of panic. Hearing the word cancer triggers this massive, overwhelming sense of urgency, right? Your instinct is probably screaming, "We have to get this out of me tomorrow. I need surgery right now." It's completely natural to feel rushed, stressed, and just desperate to do something. But guess what? Medical professionals actually advise the exact opposite approach. Dr. Masuda, a prominent professor and breast specialist at Kyoto University Hospital with over 25 years of clinical experience, emphasizes something absolutely crucial. He says that breast cancer does not suddenly progress or spread uncontrollably over the course of 1 or 2 months. I really want you to let that sink in for a second. You have permission to pause. You actually have the time to adjust your work schedule, talk things through with your family, and mentally prepare yourself before starting any treatment. Rushing blindly into the very first available option, it's just not necessary. And the reason you can afford to take a breath really comes down to one incredible number: 95%. That is the 5-year survival rate for stage 1 and stage 2 breast cancers today. This isn't just some random statistic. It's a massive, concrete, data-driven reason for hope. Thanks to some truly unbelievable advancements in standard medical care, breast cancer has become a highly manageable disease. So, take a deep breath, you've got time, and the odds are heavily in your favor.
So, here's our roadmap for today. Number 1, post-diagnosis, no need to panic. Number 2, basic treatments by stage. Number 3, current surgery and reconstruction. Number 4, evolving drug and immunotherapies. And finally, number 5, choosing your doctor wisely.
Let's start with part 1. Post-diagnosis, no need to panic. When that diagnosis first hits, keeping a clear, level head is literally your absolute best tool. Panic completely clouds your judgment, and you're about to make some pretty important decisions. So the crucial takeaway here is this. Take 1 to 2 months to plan. Your tumor is not going to grow overnight. Doctors actually want you to use this specific window to get your life organized. Figure out your leave from work, arrange childcare if you need to, and just allow yourself the emotional space to actually process what's happening. The cancer isn't going to dramatically change stages in a matter of weeks. You are safe to plan. Moving right along to section 2, basic treatments by stage. Once you've taken the time to breathe and plan things out, your medical team goes to work. And let me tell you, treatment today is absolutely not a guessing game. It's a highly precise, calculated sequence. First, they confirm the diagnosis. Second, and this is super vital, they do a pathological check. They aren't just looking at how big the tumor is, they're essentially looking at its personality. Is it sensitive to female hormones? Does it carry a specific protein called HER2? Only after they understand the exact microscopic nature of your specific cancer do they move to step 3, developing a highly customized treatment plan just for you. And when we look at the data, it's just incredibly reassuring. At stage 0, the cancer is non-invasive, meaning it hasn't spread beyond the milk ducts. With surgery, it's almost 100% curable. For stage 1, the recurrence rate over a full 10-year period is less than 5 to 10%. And for stages 1 and 2, which, by the way, is where the vast majority of patients are diagnosed today, the 5-year survival rate is over 95%. Basically, 9 out of 10 people easily survive past the 10-year mark. To put that into perspective, this is a highly manageable disease today. All right, part 3, current surgery and reconstruction. Even with those fantastic survival numbers, the thought of surgery brings up some very immediate, very real physical fears. So many patients are terrified of losing their breast and the impact that's going to have on their identity and body image, which is completely valid. Depending on the size and spread of the tumor, surgeons might recommend a partial mastectomy, which removes just the tumor and a tiny bit of surrounding tissue. Doctors are actually incredibly skilled at shifting the surrounding fat to maintain the breast's natural shape as much as possible. But what if the tumor is larger and you need a total mastectomy? Well, the incredible news here is that breast reconstruction, using either your own abdominal tissue or artificial implants, is now this incredibly advanced, beautifully refined procedure. Plus, it's often fully covered by standard healthcare insurance. You can get the cancer out and still maintain your body's silhouette. It's truly amazing.
Which brings us to Section 4, Evolving Drug and Immunotherapies. So, surgery physically removes the tumor, right? But what about those microscopic cells that might have sort of wandered off? This is where the sheer magic of modern medicine truly shines. We've got to dive into this next concept because it is genuinely fascinating. It's called an ADC, or antibody-drug conjugate. Think of a traditional cancer drug like a shotgun blast. It hits the cancer, sure, but it hits everything else around it too. An ADC, on the other hand, is like a laser-guided smart bomb. It's literally designed to recognize and attach directly to specific proteins on the outside of a cancer cell. Once it latches on, it injects the chemotherapy medication straight inside the cancer cell, completely bypassing your healthy cells. How cool is that?
Because traditional chemotherapy affects your whole body, it leads to those severe side effects we all dread. But ADC therapy drastically cuts down those side effects because it's just so hyper-targeted. In fact, in some cases, delivering these advanced drugs before surgery can cause the tumor to completely disappear. Imagine that. The medicine shrinks the tumor so effectively that by the time you even roll into the operating room, the cancer is virtually gone.
Now it is time to bust a major myth. About 8 out of 10 breast cancer patients have tumors that actually feed on female hormones, specifically estrogen. So the primary treatment for them is hormone therapy to suppress that estrogen production. Now, does this mean your hair is going to fall out? No, hormone therapy does not cause hair loss. It can cause a few other manageable side effects like some joint pain or changes in your skin's elasticity, but it is a highly effective, targeted treatment that spares your hair entirely. Next up is immunotherapy. And I want to be super clear right now. We're not talking about some unproven internet scam about eating blueberries to boost your immune system. This is hard clinical science. You see, cancer is really sneaky. It actually puts up this invisible molecular barrier that tells your body's white blood cells, hey, nothing to see here, I'm just a normal, healthy cell. Clinical immunotherapy literally strips that shield away. It rips down the barrier, suddenly exposing the cancer so that your body's own natural immune system can see it, attack it, and wipe it out.
All right, our final section, choosing your doctor wisely. So, we have the time, we have the data, we've got the surgical options, and these brilliant smart drugs. Let's move to our final, and honestly perhaps most empowering phase, putting you in the driver's seat of your own care. The treatment timeline really requires a long-term view. Think about it. Diagnosis takes a few weeks. Active treatment, like surgery or initial chemo, that takes a few months. But the follow-up, the hormone therapy and the monitoring to make sure the cancer never comes back, that takes 5 to 15 years. You aren't just picking a surgeon for a one-off procedure. You are choosing a medical partner for the next decade of your life. Having good personal chemistry with your doctor isn't just a nice to have, it's an absolute necessity.
So how do you actually find that perfect partner? Well, here is your actionable checklist. First, always seek out certified facilities and specialists. Second, prioritize proven standard care. Remember, standard care is standard because it has been rigorously, scientifically proven to work. Be super cautious of those flashy clinic ads promising unverified miracle cures that aren't covered by insurance. Third, and please hear me clearly on this, it is your absolute right to request a second opinion. A good doctor is never, ever going to be offended by that. And finally, choose a doctor you can easily chat with, someone who truly feels like a trusted ally in your corner. We've covered a whole lot of ground today, right? Everything from that initial shock of diagnosis to the unbelievable science of modern therapies. But if there is just one thing you take away from this explainer, I really hope it's this final thought. Will you take a breath, take your time, and choose the right partner for your journey ahead? You don't have to rush. The science is completely on your side, the odds are highly favorable, and you are entirely capable of navigating this. Thank you so much for learning with me today on The Explainer. Stay curious, stay informed, and I'll see you next time.